Hi, everybody. Good evening. Welcome along to the sixth in our series of webinars, specially designed for under 40s living with type 2 diabetes. So this webinar is a part of a series created for people aged 18 to 39 living with type 2 diabetes. These sessions are designed to give you the knowledge and the tools to take control of your health and do it with confidence. So just a few quick notes before we begin. This is a safe and supportive space. So your camera and your microphones are off and your name isn't visible to anyone else. You can send in questions to the Q&A box at the top of your screen, at the little ribbon along the top. And these will stay anonymous as well, and we'll answer as many as we can. So please do use that. And you will get the recording afterwards as well. There will be a slide that covers this bit, but just a quick reminder, this session is for education and support only and doesn't replace personal medical advice. So always speak with your GP or diabetes healthcare team before you make any changes, and the information in this is for people living within Sussex. So if you are watching this outside of Sussex, then the information might not be relevant to you. So I will be quiet in a minute and introduce our lovely speaker tonight, Jane Sudlow, who is a psychotherapist for Diabetes Care for You team in Sussex Community Foundation Trust. So Jane, over to you. I'm going to take myself off screen, put your presentation on, and I'll come back on at the end with the Q&As. So over to you.
Thank you. Okay, lovely. So hi everyone, my name is Jane. I'm a psychotherapist in a service called Diabetes Care for You. And I'm here to talk a little bit about the emotional impact and ways in which you can look after yourself better if you are living with type 2 diabetes that's been diagnosed when you were younger. So you know a little bit more about what kind of things to look out for, and we're also going to have some ideas about how you can look after yourself better emotionally and psychologically when facing some of the challenges of living with diabetes. So this next slide, I think, Francis, this is the slide you were referring to, is that right? So I'll just move on to the next one, or do you want to say? No, I'll move on to the next one. Okay. So we can't cover everything in one session. So this is a taster and an introduction to some of the psychological concepts around living with diabetes. And there's lots of information about where you can get support and help at the end, and we will have some time for questions. But in essence, it's about helping you understand and how to improve your emotional well-being, and to think a bit about how this interacts with your diabetes, and to look at what may be different about living with early onset type 2 diabetes compared to other types of diabetes. So what we're going to cover, we're going to look at how we think about diabetes and how that might affect how we feel about it, how it affects our emotional state. We're going to be looking at some of the stresses of living with diabetes and understanding how we react to diabetes, and also how we can get support and how we can work towards supporting ourselves. So what is the first thing that you think about when you think about type 2 diabetes? The kinds of things that you might see in the media will talk a lot about sugar, about weight, about diet. And there are lots of myths and misconceptions about diabetes, particularly type 2, that can sometimes be confusing and difficult. And we'll tackle some of these issues later in the presentation, but maybe just make a thought or a note of some of the initial thoughts that you have, or that you think others might have about diabetes. So firstly, type 2 diabetes that affects younger people is often misunderstood, and there's often a lot of blame placed on those who have a diagnosis of diabetes of type 2 in early life. So we know for a fact that there are strong genetic components to developing type 2 diabetes early in life. We know that it affects Southeast Asian, Black African and African Caribbean families in Britain, and that they have often witnessed type 2 diabetes across generations of their families. So we know for sure that there can be a strong genetic predisposition. And understanding that there is a genetic component to this is very important when you're counteracting some of those more blaming attitudes that people can have towards type 2 diabetes. And it can also help us understand what's within our control and perhaps what we can change, because there's a lot that you can do about type 2 diabetes in terms of simple things like attending your appointments, taking your medication if you need medication, monitoring your blood glucose, or maybe adapting to a healthy diet. So I think it's important to say that there can be an emotional toll of living with diabetes earlier in life for a number of people, and that may not be everyone here. So maybe it's important to say that some of the things I'm saying about talking about you may not directly relate to, but some of them you may. But some people living with early onset type 2 diabetes may have seen loved ones struggle with diabetes related complications, and that sometimes can create a sense of fear about the future. For some people, they feel responsible for their diagnosis and they might believe that they should have done more to avoid it, even when we know that genetics play a major role in the development of this condition. And some people with diabetes may struggle with feeling different, especially if their needs aren't understood at school or at work or with their friends, or even sometimes within their own families. So I thought it would be useful to talk a little bit about some of the key myths that come up when people think about type 2 diabetes. I often hear people talk about feeling like they can never eat sugar again, that sweet things are terrible, they're bad, that anything with carbohydrates in it is evil. And actually, that's not the case. Sometimes it's about balance, but none of these food groups are inherently harmful. So one of the key myths is that type 2 diabetes only happens to older and overweight people. And we know that early onset type 2 diabetes can affect younger individuals of all body types due to genetics, sometimes due to lifestyle or other factors. Some people might feel or be aware of the myth that it's your fault, that you caused it. Now, that definitely is a myth, because while lifestyle factors play a role in terms of what we maybe eat or how much we exercise, it is true that genetics and other uncontrollable factors are also significant contributors. Some people may have heard or feel that if they take medication, that somehow that's a failure. But what we do know is that diabetes management is very personal, and medication can be a necessary, effective, and very positive part of treating a condition to prevent further complications and keep people as healthy for as long as possible. And it's also true that in the last 5 years alone, the development of diabetes treatment has been significant in its advances. So there's big steps in improving the treatment of type 2 diabetes. So even if you've had the experience of being in a family where earlier generations have had experiences of difficulties, these things may well not be in your own future because of the new treatments that we have for type 2 diabetes. Some people might have heard that type 2 diabetes isn't serious. Well, that's also not the case, because we know that if it's left unmanaged and without proper support and medical care, it can lead to severe complications. But it can also be extremely manageable with the right care and support. So I just want to say a little bit about diabetes, food and our bodies, because it's important when we're thinking and looking after ourselves. Because having diabetes inevitably creates a focus on food, And sometimes this focus can be hard to deal with on an ongoing basis when you're having to think about what you're eating and the impact on your blood glucose on a daily basis. There can sometimes be challenges of changing what we eat for better blood glucose control. And sometimes it can be difficult when we have a relationship with food that affects our emotions, or where we manage our emotions by using food. So for lots of people, that's a very normal activity. To soothe ourselves, for example, with food is absolutely normal. But it can be that some of these behaviours are maybe more dominant in particular people. So learning to support our diabetes without cutting out or depriving ourselves of certain types of food, but also moderating elements, can be really important. And changing how we eat, what we eat, can be very difficult. So sometimes it's really helpful to work with diabetes professionals. That could be a dietitian, or it could be a psychotherapist, or both, to support you in making appropriate and measured changes. From a psychological point of view, some of that might be about understanding how feelings and emotions affect what and when we eat, and learning new ways to manage difficult feelings. I put this slide in because I think it's important to think about what happens when we ignore our diabetes, but also to understand it. So it's a very normal reaction to, particularly when we first hear about a diagnosis of something like type 2 diabetes, to be in a state of denial, because it's a way in which our brain protects us from overwhelming emotional demands. Now, that can be helpful in the short term, in that it can allow us to keep functioning. But in the long term, it also becomes unhelpful because it stops us from addressing some of the long-term problems that diabetes can cause. So taking that first step to move from ignoring or denying our diabetes into acceptance can feel risky, but it can also significantly benefit your health. So the key points here are that denial stems from a fear or an overwhelm or misinformation. It's important that we normalise that. We acknowledge that denial is a common and natural reaction to life-changing news, but also that small steps matter. You don't have to change everything all at once. Beginning with small, manageable changes is probably a better way to approach change in general. And we need to have empathy and patience with ourselves. So we need to encourage self-compassion, to remind ourselves that acceptance can take time. And also that support can really help. Talking with trusted friends, family, or professionals can help us to process some of these difficult emotions, particularly when we're first learning about a diagnosis like diabetes. And the other thing that I just want to mention in terms of how diabetes can affect people is a concept that you might hear that's called diabetes distress or diabetes burnout. Now, that's a state of kind of emotional and physical exhaustion that can push us into denial, and that can occur perhaps when we're overwhelmed with managing our diabetes. People can sometimes feel powerless or alone, and that might lead them to ignoring or forgetting about their condition, avoiding medical appointments, checking their blood glucose, etc., and having a lack of motivation. And the reason that I'm bringing that up is that if you start to notice that within yourself, that really is a time to maybe talk to your GP or to the nurse in your GP practice that might specialise in diabetes, or if you're part of a specialist service like Diabetes Care for You, that is a time to talk to your clinicians and help, because they can really help you think about perhaps having a referral to talk with someone like myself, to work through some of those difficult feelings and shift you back into feeling that you're more able to cope with your diabetes and to manage it on a daily basis. So one of the things that often comes up when I meet with people is how they might want to, or how they might tell people that they have diabetes. And maybe the important thing to say there is that you don't have to tell everyone. So it's always an important question to ask who needs to know and why. And once you've made that decision, to make sure the environment in which you're telling someone is comfortable to you and that you have some privacy. So that decision might take some thought. It's not something to rush. It's also helpful to be quite clear, to be direct, to keep it simple, just to say what you want to say in terms of the condition, to say that you have diabetes, something simple about it, and maybe communicate what it is, why you're wanting to tell that person in the first place. It might be that you're telling someone who's never heard very much about diabetes, who doesn't know very much. So you might need to share some basic facts and address some of those potential misconceptions that we looked at earlier. It's super important, particularly with maybe some of your family members, that you might want to think about expressing your diagnosis in quite positive terms. If you think that they're going to worry about you, then maybe it's important to talk about how you're managing your condition so that they've got a real understanding that you are able to look after yourself. And the other thing is about tailoring your message. So are you asking for support from someone? Is this a practical need, perhaps from an employer who you're asking to have extra time at lunchtime to measure your blood glucose, to spend time, perhaps to use insulin? Your employers are obliged to make reasonable adjustments. So it is something that you can do, and they should be able to support you in living with diabetes so that you can function as well as you possibly can at work. And these can be difficult discussions to have. So again, if you want to talk that through, some of the therapy options that I'll come up with at the end could be very useful, or simply talking to a friend. So living with diabetes can be stressful. Life can be stressful in general, but what is stress and how do we recognize it? So there can be psychological symptoms of stress. Now, sometimes there's positive stress that helps us engage and function and get on with life. But if we've got overwhelming stress, we can find it difficult to concentrate. We can feel overwhelmed. We can struggle to make decisions. We can become forgetful, or we can just worry a lot. That in turn, I mean, our brains are attached to our bodies, and we can have physical symptoms of stress as well. We can have headaches or muscle tension, maybe feel tired and exhausted. Sometimes we might feel that our heart rate is beating faster than normal, or it might affect our digestive system in some way. And that in turn might also impact our behaviour. So it might be that we're a bit more irritable, that we're eating too much or too little, sleeping too much or too little, maybe avoiding tasks or neglecting our needs. But stress can have an impact in a number of ways, and we all react slightly differently to stress. So this is a diagram called the stress bucket, and you'll see at the top there are a number of issues dealing with change, poor diet, lack of sleep, health worries, etc. And they are all raining into the bucket that sits below. Now, how the stress bucket works is that it represents your personal limit for dealing with stress. And what's important to really understand is that the size of your bucket is unique to you. It's influenced by factors like genetics, your past experiences, and your current mental state or your psychological state at any one time. And the water, well, this is stress from various sources in your life, such as work, finances, relationship, health issues. But the holes at the bottom of the bucket represent your coping mechanisms, and they are key to managing stress. The more holes you have in the bottom of your bucket, the better. You can try to develop new ways of managing stress. And therapy can be a very good way of identifying some key ways of doing that. So you can reduce the flow of new stress perhaps by making changes to your life, like saying no to new commitments when you already have enough on your plate, starting to do something new that you enjoy, talking and sharing with trusted people, and really focusing on rest and relaxation, because we don't want that bucket to overflow. So the more skills you have to engage in those coping strategies, the better you're going to cope with stress in your life in general. And self-care and rest, particularly when you're managing a condition like type 2 diabetes that requires your attention every day, it is very important. If you look at this diagram, if we have a full battery, then we're able to care for ourselves, we're able to support others in our lives as well, those people that are important to us. We're able to put energy into our life. But it is important that you also have a healthy amount of putting your own needs first, so that you've got enough power in your battery. And another important thing about having a good sense of balance in life is that we balance the amount of things that we are trying to achieve. That's often work or college or school or something to do with work. That we also have enough connection with other people, and that we also have enough fun. And often I'm working with people where maybe one of these is overwhelming the other two. Particularly work can be a big thing there, where people feel overwhelmed with work and there's not enough space for them to connect with other people. And all of these different activities, achieving, connecting, and enjoying, actually release different neurotransmitters in our brain that feed our general sense of well-being. And having a good balance of those can be really helpful in terms of helping us feeling content with life. I thought I'd talk a little bit about thinking, particularly worrying thinking, because that comes up a lot in the work that I do with people. So worry, what is it? It's basically a chain of negative thoughts that make us feel anxious. And thoughts are just thoughts. And our initial thoughts about situations are automatic, but sometimes if they repeat, they can become intrusive and automatic. So worrying thoughts can be difficult to deal with, but we can start by dividing them into two categories. There are practical worries. So a practical worry is something you can do something about. So that could be, if we're thinking about diabetes, it might be that you're having particular difficulty taking a certain kind of treatment, or you're worrying about the amount of treatment that you're taking. You might have challenges with food and diet. But these practical worries are something we can do something about. We can do research, we can find solutions, we can ask for help from professionals, we can talk to our friends. And very often there'll be some problem solving, and that will deal with the practical worry. The ones that are a bit more complicated are our hypothetical worries. And as human beings, we're often very good at developing hypothetical worries. And that's mostly because our brains are so creative. So a hypothetical worry is a worry about a future event that may happen and about which you have very little control in the present. And with diabetes, that's often around long-term health complications. So learning more about how we think and how we respond to our thoughts can help reduce stress and worry, and dividing our worries up can also help. So practical worries we can do something about. But the question is, what do we do with those hypothetical worries? Well, there are a number of techniques that you can learn and that are available to you for free to learn, actually. So with hypothetical worries, one of the most successful methods of managing that is a technique called mindfulness. And mindfulness simply means becoming aware of the present moment. That might seem very simple, but actually it can require some practice. Now, that might just be something like being mindful in any activity we're doing. So that could be, for example, if you're doing the washing up, just focusing on the feeling of the water as it's touching your hands, or as your hands enter the warm water in the washing up bowl, and just focusing on that for 2 or 3 minutes, or maybe even 30 seconds. So the person that developed, one of the people that developed mindfulness in healthcare in particular, talks a lot about the fact that we should be described as human doings, not human beings, because we spend a lot of time just doing stuff and not simply being in the moment. And if you think about it, we often spend a lot of time thinking about the future, what's going to happen next, or what happened in the past. And if we can develop more time to think about being in the present, particularly in this mindful way, it can do a lot to help us let go, to separate ourselves from some of these hypothetical worries. And we can also engage in more structured mindfulness when we're overwhelmed with worries or anxiety. And that might be something like a mindful breathing exercise, or a body scan, or simply some grounding techniques using our senses, counting down from 5 to 1, or taking your socks and shoes off and feeling the grass beneath your feet on a warm summer day. All of these are examples of being in the moment and being mindful and stepping back from your thoughts. Now, that's not the only way of managing hypothetical worries. It's just one example, but it can be a very effective one. But I thought what would be useful is to think a little bit, if anything that I've spoken today has stimulated some questions or made you think about accessing further support, it's useful to think about what is available and what's available in Sussex in particular. So through your primary care, through your GP, you can access what are called NHS talking therapies. And in Sussex, there are 3 services, one in Brighton and Hove called Brighton Wellbeing, one in West Sussex called Time to Talk, and one in East Sussex called Health in Mind. So, for example, Health in Mind in East Sussex runs an online 8-week course on learning mindfulness. Now, that is free, and you can self-refer to access that course. You can self-refer to any of these services if you're in the location that they serve, and you will get an assessment. Sometimes you can refer to some of their online courses. West Sussex do a course specifically on living with long-term conditions, but they also offer one-to-one therapy for time-limited periods, but they do offer one-to-one work. And all of these services have a pathway where there are therapists that work in those services that have had specific training on working with people with diabetes. So it's called the long-term conditions pathway. But you can reliably access those services knowing that there will be people who have experience and knowledge of the kinds of issues that we've talked about today. If you happen to be being seen and have been referred to Diabetes Care for You, there is also, I'm part of a psychotherapy team in Diabetes Care for You. And I'm just going to move on to the next slide, because you can self-refer to that service or speak to the doctor or nurse or dietitian or podiatrist. Anyone that you're seeing in that service can refer you, or you can refer yourself just by emailing to the email address on the screen. Just important to put your NHS number, your date of birth and your full name. And you will be referred and receive a phone call from one of the team members probably within a week or so of having sent that email. So there is lots of support out there and lots of ways of helping you manage your health better. And this is a very manageable condition, but it can have some difficulties. And sometimes we need a bit more support to help us navigate some of those difficulties. This last slide, or it's one of the last slides, is really just to think about what's available if we feel that we're in crisis, if we're in an emotional and psychological state where we're finding things extremely difficult, because these services listed here are important in letting you know that help is out there, even when we feel that nothing can help at all. They're there to provide support when you feel you're at rock bottom. They're there to provide support in a crisis and help with resolving a crisis situation, to keep someone safe and keep people moving towards a place of being able to cope and to access further psychological support if that is needed. So these are important numbers just to have if you need them. So that's kind of it from me. I think it might be worth just having a think about what you've learnt, maybe what was useful, any changes that you might want to implement. But obviously, as Frances has said, those are important things to talk with the people that are supporting you medically with your diabetes. So I'd just like to thank you for your attention today and for coming, and to say that we've got some time for questions if you'd like to ask them. Thanks.
That's brilliant. Thank you so much, Jane. That was so helpful and so positive. And I hope, people have taken some really good things from that. There's lots of really great thoughts and tips. So a few questions, if that's okay. So if someone has been advised to make changes around diet, because obviously that's a really important thing with diabetes, but they're finding it quite hard to do so, how can they get help?
Yeah, it's a very good question, because diabetes and food are so closely linked, and having diabetes can highlight our focus on food and our bodies, and this can cause a lot of stress and anxiety, particularly if some of your eating patterns could cause your diabetes problems in the long term. So there are several ways. So accessing some of those therapeutic sources from the talking therapies is one way. Talking to your clinicians, if you have access to specialist dietitians, which you may do depending on the service you're involved in, that can be really, really helpful. But also thinking about how we make change, how difficult change can be, and the best way to think about making changes is something that psychological therapy can help with. And they can help. We can also, in a diabetes, people who are trained in diabetes can help support change that fits with our lives and improves our health at the same time, and isn't enormously radical. There's lots and lots of fad diets out there, lots of advice about not eating carbs ever. Well, actually, we need these things in our lives. So I would say that accessing support therapeutically or from your clinician is a first step.
Yeah, absolutely. And we have had one of the webinars has been on carb counting and one's been on weight management. So there's the kind of knowledge and some tips around that. And then Jane, as you said, because there's knowing one side and doing as another, and knowing and doing are very different things, isn't it? So it's about how you take that knowledge and how you action it. Brilliant. Thank you. What about, someone has said about that they have been told that they have to start using insulin, but they've got a phobia of needles. How would someone get help around something like that?
So, I mean, needle phobia is actually really quite common. There's lots of people who have a fear associated with needles or with blood, and it's a worry that can create a real barrier, particularly to the treatment of diabetes, and in that situation in particular. So, but there are some very strong evidence-based treatments in psychological therapy that can be really successful in helping people overcome those fears in a very safe and calm way. And this approach is available in all those talking therapies that I described, and also at Diabetes Care for You. So I think if people are aware of that, then it's a good thing to tackle, because it will just remove a lot of the anxiety from these situations in the future or in the present.
Yeah, brilliant. Thank you. And then finally, what about talking with others who have early onset type 2 diabetes? What support's out there?
So there are some support groups in Sussex that are listed in Diabetes UK. on their website, and there are informal and sometimes private groups run on Facebook. I'd approach them with some caution. There are some groups that are attached to GP practices that I've discovered. So going to your GP, often they have kind of community health projects. And diabetes is a big issue for lots of GPs. They're managing a lot of patients with type 2 diabetes. So there may well be support available through your GP practice. And talking therapy groups are also available. So I know that in some parts of Sussex there is a course that supports people living with long-term conditions, including diabetes. So it's not exclusively diabetes, but there certainly would be people in that group probably who also had diabetes. And in Diabetes Care for You, we have a group which looks at mood. It's called the Mood and Food Group, and it's available to anyone accessing that service. And it's just a very positive environment where people can learn about their relationship to food, explore changes that they might want to make to improve their well-being, not necessarily what they're eating, but also have the experience of talking with other people with diabetes. That's often one of the most helpful parts.
Brilliant. Thank you, Jane, so much for that. It was really helpful, and thanks everybody for joining.